Hello, my name is Morgan Dunn, and today I'll be presenting to you Neimann Pick Type C (NPC). Neimann Pick disease type C (NPC) is a rare progressive genetic disorder characterized by an inability of the body to transport cholesterol and other fatty substances inside of cells. This leads to the abnormal accumulation of these substances within various tissues of the body, including brain tissue. Neimann Pick type C is a rare inherited disease. The genetic mutations of this type cause cholesterol and other fats to accumulate in the liver, spleen, or lungs. The brain is eventually affected too. Lysosomal storage diseases are inherited metabolic diseases that are characterized by an abnormal buildup of various toxic materials in the body's cells as a result of enzyme deficiencies. There are nearly 50 of these disorders altogether, and they may affect different parts of the body, including the skeleton, brain, skin, heart, and central nervous system. While clinical trials are in progress on possible treatments for some of these diseases, there is currently no approved treatment for many lysosomal storage diseases. Neimann Pick type C (NPC), which is a lysosomal storage disease associated with mutations in NPC1 and NPC2 genes. Neimann Pick type C affects an estimated 1 in 150,000 people. Approximately 50% of cases are present before 10 years of age. NPC patients are not able to metabolize cholesterol and other lipids properly within the cell. Consequently, excessive amounts of cholesterol accumulate within the liver and spleen, and excessive amounts of other lipids accumulate in the brain. There is a considerable variation in when type C symptoms first appear, and in the progression of the disease. Symptoms may appear as early as a few months of age or as late as adulthood. Symptoms may include enlarged liver and spleen, difficulty coordinating movement, abnormal eye movements, poor muscle tone, severe liver disease, frequent respiratory infections, difficulty with speech, difficulty with swallowing and feeding, loss of cognitive skills, and seizures. In most cases, neurological symptoms begin appearing between the ages of 4 and 10. Individuals with NPC can have an onset of symptoms at different ages that have been grouped historically as perinatal, shortly before and after birth, early infantile, 3 months to less than 2 years, late infantile, 2 to 6 years, juvenile, 6 to 15 years, and adult, 15 years and greater. NPC affects neurologic and psychiatric functions, as well as various internal organs. Symptoms arise at different times and follow independent progression. Visceral symptoms are more typically seen in individuals presenting at a younger age. Neurologic and psychiatric symptoms often occur slowly over time and thus feature more prominently in individuals presenting in the later age groups. Individuals with NPC have mutations in one of the two genes, NPC1 or NPC2. Approximately 95% of the affected individuals have mutations in NPC1. Genes provide instructions for producing proteins that play a critical role in many functions of the body. Mutations in a gene may lead to the production of a protein that has reduced or abnormal functions or to the absence of the protein. The diagnosis of NPC is confirmed by biochemical testing that demonstrates impaired cholesterol esterification and positive philipin staining in cultured fibroblasts. Biochemical testing for carrier status is unreliable. Treatment of NPC may require the coordinated efforts of a team of specialists, pediatricians, neurologists, ophthalmologists, pulmonologists, gastroenterologists, and other healthcare professionals may need to systematically and comprehensively plan an effective child's treatment. Psychosocial support for the entire family is essential as well. Genetic counseling would benefit affected individuals and their families. Neimann Pick type C is always fatal. Life expectancy depends on when symptoms begin. If symptoms appear in infancy, your child isn't likely to live past the age of 5. If symptoms appear after 5 years of age, your child is likely to live until about 20 years of age. The NPC disease is characterized by highly heterogeneous presentation, making for difficult and often delayed diagnosis. The NPC Suspicion Index is a screening tool that offers considerable help in the diagnostic process of patients with suspicion of NPC. As NPC progresses in children, I hope for a cure to be found.